Securing strong medical school letters of recommendation for your application can feel confusing, stressful, and out of your control. But with a little bit of background knowledge, it's actually one of the easiest parts of the application process. So in today's video, I'm going to tell you how to secure strong medical school letters of recommendation, including answering your most frequently asked questions, such as how to ask a referee and whether or not referees have to be physicians. Hi, I'm Nadine Evans, an admissions associate at BeMo Academic Consulting. Make sure that you subscribe on whatever social media channel you're watching this from now so you don't miss any of our upcoming videos. If you'd like us to help you with your medical school application, go to bemomedapplication.com. Referees are individuals who endorse you as an applicant to medicine. They act as references, similar to if you were applying for a job. There will be some variation to how this is done between schools. For example, a school might give you directions on how to provide a reference for you to pass on, but you will still have little involvement with the process. If you want strong letters, then you must give your letter writers ample time to compose their evaluation. Writing letters of recommendation isn't or shouldn't be a quick and easy exercise. A strong letter writer will pore over the work that you've submitted to them, think carefully about their interactions with you and their overall impression of you, offer detailed accounts of projects that you've done together, demonstrate the ways in which you represent the key qualities and competencies desired in your chosen profession, and so on. All of this takes a lot of time, and a request for a letter of recommendation that arrives 5 days before the due date is unlikely to be met with such a favorable response. At the bare minimum, you need to give your letter writers at least 2 weeks' notice, though more advanced notice than this is preferable. Generally, a 1-month period will be sufficient for them to fit an exercise into their schedule, such as this. So if you're applying in June for say, make sure that you ask for your letters no later than May 1st. It's worth noting that you will also need time to select the best recommendation letter writers for the field that you're entering. These need to be people who know you well, at least on a professional level, who are familiar with your work and aspirations, and who are connected enough to the field you're pursuing to speak out about your assets and traits in the context of that profession. So you should be thinking about such things well in advance and reaching out to potential letter writers quite early so that they know that you're considering making a request in the future. Most commonly, schools will ask for 3 referees that are willing to write you a medical school letter of recommendation in support of your application. You will sometimes be given direction on how to choose these individuals, for example, a personal reference, an academic reference, etc. But the selection can still feel overwhelming. Still, there are really only 2 things to keep in mind. First, think of the strength of the individual letter. References are used because they give schools an idea of how future patients and colleagues may view you. You want to have the most positive and comprehensive reference possible. These endorsements come from individuals who know you for a long time and have observed you in different settings and tasks. You'll probably find obvious choices in your most significant activities. Perhaps you're thinking of asking a professor to be a reference because you got an A in their class. But think, if you had a limited interaction with this teacher in and out of class, what more could they possibly add beyond saying, well, the student got an A, which is already on your transcript? However, if you had a seminar for this class with a TA who read your work and interacted with you in a group setting, then he or she would be more suitable as a choice. Second, you want to think of the strength of your references as a group. Because references give schools insight into how you might function as a medical student and physician, you want to demonstrate that you're as well-rounded as possible. Perhaps you were involved in 3 significant research projects and you could collect 3 strong reference letters from each of your supervisors. But now you need to think, what possible difference could there be between those 3 letters and how would they give the school an idea of how you would work in any other setting other than research? However, if you volunteered at a homeless shelter, a reference from that activity is able to share a different perspective of you. This way, schools will know how you interact and help others in addition to your skills as a researcher. Now I want to cover a couple of frequently asked questions. Should every referee be a physician? You should have at least 1 referee from a medical doctor. The best person to assess your suitability for a profession is someone who actually practices in that profession. Having a reference who is a physician also infers that you have some awareness of the field, and that's important to schools as well. However, it's actually helpful to have referees who can describe you in multiple ways. If you have a very healthcare-based resume, you can consider asking for a reference from someone in a related profession as well. There's a huge emphasis on interprofessional collaboration in medical education. So nurses, pharmacists, physiotherapists, occupational therapists, and people from other fields that work with physicians can provide a very important perspective on how successful you will be working with these disciplines in the future. The next question is, does the referee's title matter? It's always tempting to think that the individual with the highest position or the most credentials will be the stronger referee. In actuality, the strongest references come from those with whom you've worked with the longest. They give schools a better idea of who you are and what you can achieve. Perhaps you've considered asking a manager at work to be a reference, but you need to think, if you work more closely with a coworker whom you've had discussions about your motivation for medicine, who would be the stronger reference? Schools care more about what is said about you instead of the title of the person who is saying it. Now, how to ask someone to be a referee. If you're asking a referee, you will also explain that you're applying to medical school. You could say that the time you were involved in the activity with them was a meaningful part of your professional growth, and you would appreciate if he or she would provide a reference to support your application and speak to your suitability for medicine. You'll likely be able to tell from the response you get whether or not the reference is going to be strong. If you have any doubts that the reference will not be supportive, then it's best to choose another individual who you know would be more supportive. Many applicants worry about certain areas of their application, including having a poor first and second year in university. Referees can be an important resource, and you can ask them to speak about such discrepancies in your academic performance. For example, you could say this to a professor. I had some difficulty when I first began school, but I was able to be successful in my last 2 years at school. I'm hoping you agree that I performed very well in your class. Would you be able to speak to my work ethic and your thoughts on my performance as a student? Now, a few troubleshooting methods. You should try a maximum of 3 times to contact a potential referee, at least once by phone and email each. If you can't get in touch with him or her and your inquiries are not answered, you should consider the person is unavailable and try to find another referee. If this person does not respond to you, they will probably not respond to medical school either. Sometimes referees do need reminders though. As you approach the deadline, check in with your referees who have not provided you a reference. Be polite, but say that the deadline is approaching and you're wondering about the status of the letter. You'll be able to gauge from their response whether or not submitting the letter on time is possible. If not, you'll have to begin working on Plan B, which is another referee. If you're looking for how to address this, you could say something like this. Unfortunately, without all my references completed and given to the school in time, my entire application will be discarded and I won't be eligible for admission. I appreciate that you have other demands in your schedule, and it will be helpful to know at this point if you will be challenged meeting the deadline of December 15th. So overall, it can be challenging knowing who to call on as a referee. However, with a little bit of preparation and thought, you'll be able to rally a great team of people to support you in a successful application. So this will wrap up another one of our videos, so please subscribe, like, and leave a comment if you have any questions that I didn't cover in today's video. Do you have a referee in mind but you're unsure if they would be a good reference for you? Let me know in the comment section and I'll be sure to get back to you with my recommendations. Lastly, if you'd like us to help you with your medical school application, go to BeMoMedApplication.com. Thanks for tuning in. See you next time.